Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And as I always tell you, this show is really your show. I mean, of the 20 plus years, 22 years now that we've been privileged to come into your homes, wherever you watch us. But there's been a lot of questions. And one of the questions that we have seen a number of requests on lately has been eye health and vision screenings for all ages. Now, some of that might have come about through some of the issues with the pandemic, but we're going to get some information about that anyway. So let me introduce to you two magnificent individuals who are optometric physicians. Let me first introduce to you Dr. Julie Rodman, who is a professor of optometry and the chief, otherwise known as the leader, of the Broward Eye Care Institute. Welcome, Julie.
Thanks for having me, Dr. Lippman.
Thank you for being here. And we have Jasleen Jhajj, also a optometric physician, and she's an assistant professor in pediatrics and binocular vision, and we're very proud to have her with us. How are you, Jasleen?
I'm very well. It's my pleasure to be here.
As I said, you know, the viewers really tell us what they want to know about. So I just thought it would be a good idea. And again, I don't want to just focus in on this pandemic issue and the after effects, but I do want to, it brought to my attention the fact that we've had a lot of requests to ask about vision screenings, when should certain things be done, et cetera, et cetera. So I'm going to start with you, Dr. Jhajj, because there isn't anything that's more, shall we say, close to my mind and heart than the issues of children's screenings. It's, you know, unfortunately, most people don't recognize the fact that screenings for children, and you can tell me whether I'm right or wrong, really don't really come until after the maturation of the unit called the eye, which is usually a couple of few years after their birth. So I'm going to put it in your hands and tell me when children should be screened.
Thank you, Dr. Lippman. So we actually recommend that children are screened or in fact have a comprehensive eye exam as early as 6 months of age. And I find a lot of people are surprised by that fact. There's a great program and it's available to all Americans. It's through the American Academy of Optometry. It's called the F.A.A.O program. And what that means is any child under the age of 1 is eligible for a free eye exam through this program. You just have to find a provider or a doctor who is able to take that insurance, F.A.A.O. So Nova Southeastern University optometry clinics do accept that. So so we start at 6 months of age, and of course we can't do everything at that age, but we really rule out the big things. So if there's any type of eye cancer, if there's a really high prescription that needs intervention, if the child needs glasses, those sorts of things, if there's an eye turn. Now, beyond that, beyond 6 months of age, then we recommend that children are examined between the ages of 1 to 3 years of age, at least once, and then depending on what the doctor says, you can determine the follow-up, and then yearly after that. Now, as far as, there's a huge misconception as far as a vision screening and what a comprehensive eye exam actually entails. Okay, so a vision screening, you're limited time, right? It lasts maybe 5-10 minutes. They check a few things. Usually they throw up the eye chart. Can you see the smallest line on the chart? And that's about it. But there's so much more to vision than 20/20. And so we get all of that additional information at the comprehensive eye exam. Okay, so, and I know depending on what your insurance is, what your situation is, it's not always possible to get that comprehensive eye exam. So within Broward County Schools, there is a vision screening program. So every child is screened for vision. And if something comes up there, then they are referred for a comprehensive eye exam. In an ideal world, every child should have a comprehensive eye exam on a yearly basis. Now, I have the pleasure of working with Broward County Public Schools, so Nova Southeastern University College of Optometry. Prior to the pandemic, we had a contract with them. And so we would go into the schools and we would assist with the screenings, and we attempted to expand those vision screenings, trying to cover more areas other than just visual acuity, so smallest line on that chart. So, I mean, it's a great question. You know, I feel as though if it's within your means, getting that comprehensive eye exam is going to be the best way to go about it. What else do we do in the comprehensive eye exam? So we check your vision, of course, but then for children as well, we're checking a number of other skills. So a lot of the visual skills. I think as adults, we can relate to this, right? There's more to vision than 20/20. You're stuck in front of the computer all day. You go, oh, okay, after 20 minutes to an hour, you're going, my eyes are hurting, my eyes are burning. I'm getting a lot of eye strain, right? And so it's kind of proof to you that, oh, okay, there must be more going on than this. So what we're actually checking with our children in this comprehensive eye exam, we're checking the visual skills. So the eye teaming or coordination skills. So that refers to how the two eyes work together as a team. The most common condition that people might have heard of is known as convergence insufficiency, or CI. So basically what that means is whenever we're looking up close, right, our eyes, they need to turn and point towards what we're looking at. And these kids, they can do that for a moment, but it's hard for them to keep their eyes in that position. So what ends up happening is they end up getting a number of headaches, eye strain, blurry vision. Parents might see this as the child acting out. The child doesn't want to sit and do their homework, right? Poor attentional skills. And for an adult who's not kind of aware of might be going on, they go, oh, my child is just not paying attention. I'm going to ground them. But if it hurts to see, right, they're not gonna be able to learn or gather what they need to when they're in the classroom. So we went through eye teaming or eye coordination skills. We also checked the eye focusing skills. So we have these tiny little focusing muscles within our eyes. And whenever we look up close, our eyes, they need to focus to clear whatever we're viewing. And especially with the amount of digital media children are exposed to these days, right? You're in front of screens, you're in front of tablets. Those focusing muscles, they get confused. It's hard for us to understand how to focus on those screens. And so what ends up happening is they're viewing up close, they're looking at a screen, and it's going in and out of focus. So imagine trying to learn what you need to learn in school when everything's going kind of wonky all the time, okay? So that's the eye focusing system. So we check that as well. And then we're also checking the eye tracking skills, okay? So just reading left to right, being able to keep your place on the line. Children who have poor eye tracking skills, it'll appear as though the entire paragraph is jumping around. The words are moving on the page. It's pretty incredible because I'll say it directly to my pediatric patients, to my kiddos. And I'll say, does it look like the words are moving around on the page? And they'll go, like, it's so apparent and obvious to them. And the, mom or dad is just like, whoa, really? Okay, so there's so much at work. There's so much at play here. So for a comprehensive pediatric eye exam, we're checking all of these skills. In addition to that, right, then we dilate the child. We have a look at the health at the back of the eyes. It's pretty uncommon that children are going to have conditions at the back of the eye, but it's just like, you go for your yearly checkup. with your doctor. You're not expecting always something to be wrong, but if they find something, well, you're glad that they did so that you can get ahead of it. It's the same thing with those dilating drops. We can really get a good idea of what's going on at the back of the eye, especially with children, right? We want to get ahead of these things. We don't want it to impact the trajectory of their lives. People will say, I don't want to be dilated. I'm going to be bright. Things are going to be really bright outside. Things are going to be really blurry. It's going to ruin my day. But I kind of liken it to, you got to go to the doctor's office. You got to get needles in your arm. No one likes getting needles. It's not pleasant, but it's something that that should be done so that we can have a comprehensive look at sort of what's going on there.
I really appreciate your very erudite and complete discussion about this. But many years ago, I had the privilege of being a person that dealt with, shall we say, the creation of legislation in the state of Florida. And I had the opportunity to place into law many years ago in the 1980s the requirements to involve the testing, and it was really things like hearing and certain blood tests and things of that nature at term. In other words, the child was, and all those tests were done before the child left the hospital. Now, the one thing that couldn't be done was the eye exams. An overwhelming number of people are not in the venues where whether they be public schools or charter schools or private schools, where the opportunity to have people like you and your staff and your practitioners to be able to do that type of screening. So that's why I brought it up. Let me jump over to Dr. Julie Rodman, who is the chief of the Broward Eye Care Institute. Dr. Rodman, you must be very proud of having someone like Dr. Jhajj in your compendium of physicians.
Yeah, she makes me realize that I'm getting old, Dr. Lichtman, but that's okay. That's a good thing. We have an amazing pediatric department, and I'm really happy she decided to join me because that is not my area of expertise. But I will talk for just a few minutes about the adult population. It's not as fun and exciting, unfortunately, but it's actually pretty simple. Anybody from age 18 to 65 that is otherwise healthy should come in really annually for an eye exam. Obviously, patients that have problems should be seen more often. So problems meaning if they have high blood pressure, if they have diabetes, any other anemias or blood disorders, things like that, those patients should be screened more frequently. Even patients that are on certain medications need to be screened more frequently than that. And probably I would say that our patients that are healthy in the 18 to 50-ish year range could probably go to every 2 years. So I think that varies depending on the practitioner. But we're very fortunate in downtown Fort Lauderdale because we're fortunate from an academic standpoint because we see a lot of pathology. Not so fortunate for the population because it's sad to see what's actually living on the streets. And I always say that when you look through a textbook, Dr. Lichtman, you can appreciate the days of textbooks. You often wonder who's going to wait until they have this massive lesion on their face, right, before they present. Why did they wait so long? Well, I work with those patients that have very little access to healthcare. And thank God for NOVA, because those are the patients that we're seeing and the patients that we're treating. So some of the things that we see every day are things like diabetic eye disease. Tons of our patients come in not even knowing that they have diabetes, and we actually look at the retina and are the first to tell them that they actually probably have a diabetes. So that happens almost every day. Things like high blood pressure, right? Most people don't realize that you can see high blood pressure in the eye. So a lot of times we look in and these patients haven't had a physical exam in probably maybe sometimes their whole life. So we actually tell patients sometimes some very bad news. But one of the really fun and exciting things that we're looking at now is age-related macular degeneration, because as most of the viewers probably know, there are two types. There's a dry form and a wet form. And there hasn't really been very much research done on what we can do for the dry form, which actually is pretty visually debilitating. And patients just hang around with it because there's really no treatment. But we just got a brand new instrument in the clinic that test dark adaptation. And what we're finding is that one of the first signs of a dry age-related macular degeneration is actually an impairment in our ability to dark adapt. So if we take a normal patient off the street and we have them come in and we test their ability to dark adapt and it's reduced, then it's almost like telling this patient, you have a pretty good probability that you're going to go on to develop this disease. And the idea behind this is that we want to be proactive and we want to give them instructions on how they can modify both their diet, lifestyle, recreational activities so that they don't go on to develop the visually debilitating consequences of this disease. So I think, Dr. Lippman, I told you this a couple of weeks ago, but we've been very fortunate at the Broward location and most of our locations to have the best technology. We were one of the first colleges to adopt this non-invasive imaging modality that most of the schools didn't have at that point. So I'm very excited to work at the school. I've been here almost as long as you, and it's been a pleasure. So do you have any questions to ask me after I rambled on?
No, you're not rambling on. You're being very informative. I think the most important thing, and you as I'll call you a veteran of our College of Optometry, you know that we faced a lot of shall we say battles to make people understand the importance of having a complete optometric educational institution. And I'm not going to get into the interdisciplinary battles because I think a lot of it's been resolved. However, you talk about and you're primarily talking about the unit, and when you say in Broward, you're talking about the one on Broward Boulevard, correct? Right, and which is right opposite the police station in Fort Lauderdale. And I can only tell you, just to let you know, I had a trustee, one of our trustees at the university, come in and have their eyes examined there, and said it was the most fantastic examination he's ever had in his entire life. The reason is that what you brought to the attention of our viewers is that the examination of the eye can give direction to the individuals who are being examined relative to what often is called the hidden diseases. There are a lot of things that are picked up by examining the eye. And I guess people are amazed sometimes to believe. They say, oh, well, I only went in to get a pair of glasses, or I can't read. No. But we save a lot of people's, in a sense, their lives and their ability to live a more privileged life, because very rarely do people recognize the fact that we have the highest number of people over the age of 85 in the entire United States, in our state. I'm talking about state by state. And we have the highest percentage of people over the age of 70 in the state of Florida of any state in the union. So it's everybody wants to come here to live out a functional, happy life. But if you don't recognize some of the maladies that are going to prevent you from having that, it's very difficult. And I'm glad you brought up the issue. Thank you. Anyway, Dr. Jhajj, we're getting back to you. Children, I know that we get a lot of referrals, and we had discussion before the show with reference to our affiliation with Bascom Palmer at the University of Miami. So why don't we talk a bit about that?
Yeah, so we have a great relationship with Bascom Palmer. We have students rotate through their clinics, and we work very closely with the ophthalmology department there. So, for example, if I have a patient with an eye turn, a child with an eye turn, sometimes when you have an eye turn, that requires surgery to help straighten out those eyes. So we'll refer to doctors there. We work a lot with Dr. McEwen, who's amazing. And vice versa, they'll refer back to us. We'll get a lot of referrals for vision therapy from Dr. McEwen as well. And so vision therapy, it's like physical therapy, but for your eyes. And so we see them on a weekly basis here. So it's really been an amazing relationship. We're really fortunate to be located where we are at Nova Southeastern University. I feel fortunate to be working with Bascom, which is one of the oldest eye hospitals, very respected, very revered. So it really does help us to provide the best possible care for all of our patients. So I'm very fortunate for that.
Yeah, well, we are too. We're very proud of that relationship. Bascom, of course, is internationally known as probably one of the top eye care venues in the world, not only the United States. We're down to the last 4 minutes of the show, and I'm glad that we got to talk about a lot of these things. I just want to get to Dr. Rodman one more time. And Dr. Rodman, let's tell, we spoke about, we have a lot of mature individuals. I never say elderly. My mother would not be very happy if I said elderly. But what you say, when should John Q. Citizen come in and visit with you? Was it once a year, twice a year, once every 3 years, et cetera, et cetera? Dr. Rodman?
As long as the patient's healthy, 1 to 2 years is appropriate. I just wanted to add one thing, Dr. Lipman. At our main campus, we have some awesome specialty clinics that I'm not sure that the community is aware of. We have a service specifically devoted to diabetes and retina. So patients that have diabetic eye disease that want a consistent provider can certainly make an appointment at that service. We also have a glaucoma service that really is devoted to some of the more complex cases that, again, some patients want to go back to the same location, see the same provider. And we also have low vision, contact lens. So I want the community to know that we do have many sites and many different wonderful advanced care clinics with great opportunities. We have a dry eye service. We have a traumatic brain injury service. We have sports vision. There's so much that the community probably is unaware of, but if you call the main number for the Eye Institute, all of those appointments can be made through that scheduling center, and they're wonderful opportunities for patients not have to travel far to see doctors that are, highly specialized and highly trained. Otherwise, we do have obviously our primary care services, which are outstanding as well, and we've been kicking and doing a great job over there. But hopefully this will, the community will become more aware of the great opportunities that we have. And I hope that we'll get to meet some of the people out there that haven't had an eye exam, and this will be their opportunity to bring their kids in, right, Dr. Jhajj, and we can take care of the whole family.
Yeah, that's great. And I really appreciate your longstanding involvement with us and your incredible dedication to eye care. I really thank you very much. Folks, the Eye Care Center that is here in Davie, Fort Lauderdale is right on University Drive and 20th. It's the ZIF Clinic. And, even through the pandemic, by the way, we were one of the few healthcare facilities with multiple healthcare opportunities to be cared for. And because we adhered to all of the CDC, I could say, doctrines, and we kept our clinics open. Be wise. Choose to have your eyes examined, as Dr. Rodman said, at least every 2 years, that's for sure. So thank you for showing up. And remember, I always tell you, whatever health professional you're going to visit, don't hide anything. If you have over-the-counter preparations you're using, like eye drops or things of that nature, you have to let them know. You just can't walk in and let them guess. So please, make them aware of it. Remember, this show is called Dateline Health. We come to you from Nova Southeastern University. And as I always say, this is your show. So if you have any comments or queries, there's an email address and a telephone number right here. Just give us a little shot, either on your computer or give us a call, and we'll try to get you the answers. My name is Fred Lippman, and this program is called Dateline Health. Until next time, see you.